Hey there. Today I want to go over the job of the hip. Okay, this is one of the most important joints in the body, especially if you've been dealing with recurring low back pain, knee pain, or hip pain. If you don't know who I am, my name is Dr. Matt Moreno. I'm a sports chiropractor with years of experience working in professional sports. Everything I share is based off of what I've actually used and seen work when helping my patients get out of pain and move better long term. When looking at the job of the hip, it's helpful to look at it through the frame of mobile versus stable. Okay? Every joint in the body either alternates between a mobile joint or a stable joint. For example, the hip is designed to be very mobile. It works through a lot of different ranges and is supposed to carry a lot of the load from a mobility standpoint. Um, the joint above it, the low back, is actually meant to be very stable. That's supposed to be our kind of our foundation. It's not meant to have a ton of motion put through it. It's meant to be stable and have forces transmitted through it. All right. So we already said the hip is supposed to be mobile, and specifically, it's supposed to be mobile in these different directions. It's supposed to be able to flex, to extend, to rotate, and to move in and out. We call that abduction and adduction. When the hip can't do those jobs, that's when we see the joints above and below it start to compensate. That means that they're trying to do the job of the hip, but they're not designed to do that. So over time, they start to wear down, and that's what gives us some recurring pain or long term problems. Now, this is a very common problem because most people today don't use their hip through a big enough range of motion. We don't fully use flexion or extension. We don't challenge it into rotation, and we don't challenge all of these different movements with enough range of motion, enough strength, and making sure that tissue quality is where it needs to be. So today I want to go over an exercise that can help us move a little bit more in those ranges. Now, this does not cover all of our ranges, okay? But this is one of my favorite exercises because it covers a handful of really common ranges that people struggle with, and it can help a lot with problems like back pain or hip pain, okay? So this is called a hip hinge. So essentially what we're going to do is, while keeping our back nice and stiff, we're going to bend forward like this, moving as far as we can through the hip until our hamstrings stop us, okay? One of the more common problems that we'll see with this is people will bend through the back as they're doing it. So the idea is to keep our back as stiff as possible. There's a couple ways or a couple cues we can look at to make that happen. So one is you can put your hands on your low back like this, and you get a better feel of what's happening back there. Okay. So as we lean forward like this, okay, I can feel when my back starts to flex or move. Another cue that we can use is if you think about pointing your butt up towards like the corner of a room, that's very helpful. So as we move forward, you think about that butt moving back and up towards that corner. It helps get the hips a little bit more active and make sure that we're using that, doing that exercise properly. Okay. Um, we should, like I said, feel that in your hamstrings, not in the back. This is primarily a hip movement. So if we're feeling anything anywhere outside of the hamstrings or the hip, then we might want to look at what's going on there. Okay. And then once we have that down, what I typically like to do is use this in a couple of different ways. We can go through and just breathe into the exercise. So as we come down into this deep position, we just start taking some deep breaths and use it as like a functional stretch. So it's like a stretch under load. Okay, and we can come out, do maybe 4 sets of 10 seconds, something like that. Or you can do sets and reps with some weight. Once you get good enough at this, you can hold some weight against your chest and move back and up like this, just like that. Okay, doing maybe 3 sets of 10, 3 sets of 20, depending on how heavy the weight is. But getting really good at this movement helps. One, helps extension. It helps strengthen up the extensors for our hip. But two, it helps us control our hip flexion. And both of those problems are really common issues that I see with people with recurring back pain, hip pain, and even knee pain. So hopefully this helps you. If this video did help you, please like and subscribe to the video. It actually helps us a lot more than you know. Thanks.